Hello everyone. Today we are going to discuss an important and interesting topic. You know the meaning of family, right? Each and everyone is having different definitions and different meaning for family. You know, we love in the family, we share in the family, we play in the family, we love, we fight, and we live in the family. And we all know that no family is a perfect, right? We argue, we fight, we even stop talking to each other at times, but at the end, family is family. The love will always be there. So in the family, there are chances of problems, right? And how to sort out this problem? Through therapy, through family therapy, we can find out these problems and we can sort out these problems. So today we are going to discuss about this family therapy. Before going to the topic, we will see a small definition for family. As we all know that the definition and meaning of family is different for each and everyone. A family is a group of individuals who share a legal or genetic bond. But I've told you, but for many people, family means much more, depend upon the customs, traditions, culture, etc. And even the simple idea of genetic bonds can be more complicated than it seems. Now we will see the definition for family therapy. Family therapy is a type of psychotherapy that involves all members of family. Family might be nuclear family, joint family, or extended family. So there are different types of family. Might be nuclear, might be joint, or might be extended. So therapy we are giving to this any type of family means family therapy. Through family therapy, we can educate families about the illness and work out problems associated with the care of family members. Family therapists usually focus. Family therapist means the person who is giving treatment and who is giving counseling. So family therapists usually focus on the interaction between family members and how those interaction may foster issues. For many families seeking help, understand that family therapy is frequently short term and may be used in addition to other types of treatment. Now we will see the aim of family therapy or for what purpose we will do this family therapy. It helps the family members to improve their communication or interaction between the family members. It helps to solve the family problems if there is any problems. It helps to understand each other. It helps the family members to understand each other. And it helps to handle special family situation. You know, in family there are special situations that happening in each moment like death, serial physical problems, serious mental illness, or child and adolescent issues, etc. And it helps to create a better functioning of home environment. Well, coming to the history, we can see that family therapy was formally accepted in the psychotherapeutic community in 1960s and has continued to evolve over years. What is the purpose of family therapy? Family or benefit of family therapy. Family therapies or families can benefit from therapy when they experience any stressful event. I've told you they have to go through different kinds of stressful situation from the morning to end of their life. So families can benefit from this therapy when they experience any stressful situation or stressful event that may strain family relationship such as financial issues, divorce or death of loved one or any physical illness, mental illness, etc. It can be effective in treating mental health concerns that impact the family. It also helps to solve interpersonal conflict or behavioral problems in children and adolescents in the family. Now we will see the indications of family therapy or in which are all the situation we have to approach a family therapist to sort out the problems. Conflicts between family members. If there is any conflict and we can't able to solve this from our hand means we have to approach a family therapist. Then substance abuse or addiction. Any of them addicted with any kinds of legal or illegal substances. A family member's mental illness, from minor to moderate, severe, acute or severe, any kind of mental illness. Financial problems or disagreements about money. Problems in the school. Family relationship and changes in the family life. Adult mental health. Parenting issues. Couple relationship problems and trauma. Work stress. Parenting skills problems. Chronic health problems like serious health problems like cancers, asthmas, etc. Supporting family members through separation, mediation, and divorce. Child and adolescent behavioral problems. Emotional abuse problems, violence in the family, self harm, drug and alcohol substance misabuse. So, in all these conditions, we can approach a family therapist to find out solutions to solve the problems, because family is something special to live our life. How this family therapy process will work out, or what is the process of family therapy? Family therapy is generally conducted by a therapist or team of therapists. A group of therapists will be there sometime, or a family therapist will be there. Therapist may be a psychologist or a psychiatrist or a social worker or a counselor who is having enough experiences in this field. So, while selecting a therapist, we have to be very conscious and we have to be very careful. An experienced psychologist or psychiatrist or social worker or a counselor can give proper guidance and counseling based on their experience. Family therapy involves multiple therapy sessions conducted at regular intervals. For example, like once in weekly, twice in weekly, like that, or for several months. In a therapy session, the therapist seeks to analyze the process of family interaction and communication as a whole and do not take side with specific family members. So, they will interact with each and everyone and they will not keep in the side of a particular person. They will consider everyone as same. They will find out the process of interaction, how they are interacting each other, or the process of communication, how they are communicating each other. That is the first process we can see in family therapy. Therapists can model new behaviors for the family through their interaction with each other during the session. So, family therapists will interact with each and everyone from elder to younger. To everyone, they will interact to find out the new behaviors or new models of behaviors for the family. Family therapy is based on family system theory. It is based on a theory that is family system theory, in which the family is viewed as a living organism rather than just the sum of its individual members. Family therapy uses system theory to evaluate family members in terms of their position or role within the system. There are some steps we can see in family therapy. They are: step 1. First, your therapist will talk to everyone in the family. They will talk to each and everyone in the family to understand what's going on. Each and everyone's opinion is different. So they will ask to each and everyone what's their point of view and what is going on there in the family. And the therapist will ask questions about how each person views the problem, when the trouble started, and how the family has been trying to manage things so far. So he will keenly observe and he will ask each and everything to each and everyone in the family to manage the situation and how they are managing the situation to find out that. Step 2. The therapist will work out a treatment plan. After finding out their problem, they will work out a treatment plan. The goal is to improve conflicts in the family, not to blame anyone for the issue. Next is step 3. In step 3, the therapist will help family members to communicate better, solve problems, and find new ways to work together. So, first they will find out the problem. They will try to understand each other with the help of family therapist. So, the therapist will try to find out the problem through proper interaction. He will interact with each and everyone in the family irrespective of age. After that, they will find out a treatment plan together. They means the therapist and the family members. After that, the therapist will make each and every members to communicate each other to solve the problems and find new ways to work together. So these are all the major steps we can see in the therapy. So this is a process. While coming to the time and sessions of therapy, the average is about 12 sessions. Normally, in a normal family therapy treatment, we can see 12 sessions. How often we need the family therapist and how many sessions we'll need is depend upon the specific issues you focus on in the therapy. So it is depend upon the therapy and it is depend upon the type of issues and preference of the family members. Counseling techniques in family therapy. Which are all counseling techniques we are using in the family therapy? First one is structural therapy. Structural family therapy is a theory developed by Salvador Minchin. The focus of the therapy is based on some specific points. The specific points include the interaction between the people. First, we have to understand the interaction between the people. People means family members. Second thing is personal interaction within the family. Third thing is family structure based on social interactions. Fourth thing is functioning of the family, how the family is working, what kind of relationship they are maintaining, and family needs. So structural family therapy is based on these five principles or these base 5 points. Next is narrative therapy. Narrative therapy encourages the person to use their own skill set to address the problems and also to minimize the tiny problems in a day-to-day life. The idea of narrative therapy is that in life, people create personal stories that help them identify who they are and also they possess the proper tools to navigate their lives. So narrative therapy will help to understand tiny problems. What are all the tiny problems happening in day-to-day life? And they possess the proper tools. The family, each members can possess the proper tools to navigate their life. So narrative therapy will help to find out tiny problem and how to possess the proper tools to navigate their life. Next is transgenerational therapy. Transgenerational therapy gives a therapist the ability to examine interactions between individuals in family across multiple generations. The family therapist's observation and analysis of interactions helps the therapist to grasp the core issues within the family group. Next is communication therapy. Communication issues between individuals can start from difference in cultural backgrounds and or for personal experiences. A trained therapist can help an individual to decide what the best strategies may be for improving communication skills and ability. Strategies include active listening, opening lines of communication, and mediated communication. So, communication therapy will help the individual to find out what problems through the communication skills, and strategies we are using in communication therapies are active listening, opening lines of communication, and mediated communication. Next is relationship counseling. Relationship counseling begins usually when a couple is trying to decide whether to work out their problems and continue to be together or if they should move on. That is relationship counseling. Now we will see the types of family therapy. First one is supportive family therapy. This will help family members in expression of their feelings regarding problems that is affecting the entire family. This type of family therapy provides a safe and open environment in which everyone can express who they feel. This is an opportunity for families to get together and openly talk about the issues plaguing them, as well as an opportunity for the therapist to offer practical advice. So, in supportive therapy, family members and the therapist are working together, and it will help the family members in the expression of their feeling regarding the problem. Each and everyone can express the problem, and the therapist will get an opportunity to offer practical advices. Next is cognitive behavioral therapy. Cognitive behavioral therapy techniques attempt to change the ways the people think. You know the meaning of cognitive, right? Cognitive means or cognition means thinking. So, cognitive behavioral therapy techniques attempt to change the ways the people think or behave to reduce or get rid of the problem. The therapist may assign each individual family members with homework tasks to complete or specific behavioral program. During the session, they have some work, and after completing the task or after completing the session, the therapist will assign each individual family members with homework tasks to complete or specific behavioral program. Next is psychodynamic ideas used in family therapy. It focuses on to the individual's own conscious or subconscious mind. So it is focusing on the individual's own unconscious or subconscious mind. This type of therapy attempts to reduce problems by opening underlying problems. It is the hope of many therapists who use this method that by providing the individuals with a real reason to live and survive, and family members will be able to deal with and work through their difficulties more successfully. So, psychodynamic therapy is focusing on the unconscious and subconscious mind of the family members. Next is systemic family therapy. It focuses on the entire family's feeling. It attempts to identify the problems with a family dynamic as well as the ideas and attitudes of the entire family to uncover what may be going on with the family as whole. Once a therapist has a full understanding of these areas, he or she may attempt to shift the problems, attitudes, relationship to more beneficial or simply more realistic platform. So, this therapy is focusing on the entire family feelings. So we can conclude that family therapy emphasizes family relationship as an important factor in psychological health, and therapy focus on family problems which are seen in relation to family interactions instead of based on only individuals members of a unit. So we had a discussion regarding what is family, aim of family therapy, what is the purpose of family therapy, how we do the process of family therapy, and types and counseling techniques of family therapy. So this therapy emphasizes family relationship as an important factor instead of based only on individual members of a unit. Thank you.